So in Zimbabwe, health spending has always been one of the top priorities of government spending. According to 2026 national budget figures, per person health spending dropped from about $71 to $65, with roughly 10% of the national budget allocated to health. That's the verified pool. Now, within that pool, government and public health data consistently show that a measurable share, over 3% in some breakdowns, is spent on post-abortion care. Yes, not cancer, not malaria, not road accidents. Abortion complications from abortions that are illegal and unsafe. Because abortion is outlawed in Zimbabwe, it's not handled purely just as a medical matter, it's approached like a criminal investigation. Under the 1977 Termination of Pregnancy Act, when a woman arrives at a hospital bleeding after an abortion, yes, they might treat her, but the room isn't just thinking treatment plan. It's quite aware there may also be a case file forming somewhere that could effectively need them to notify the police. And women have absorbed one harsh lesson: don't seek medical help unless you are at the brink of death. Yes, abortion is illegal, but it's still happening about 66,000 times a year, and the government still pays just at emergency prices. In 2025 alone, over 35,000 women were treated for post-abortion complications, 85% of them in public hospital. That's already over 2 million gone, minimum, from a shrinking health budget. Now, here's where it gets embarrassing. Medical experts across Africa show that treating abortion complications can cost up to 5 times Zimbabwe's annual per person health budget. 5 times for one patient. Run that against the 35,000 cases I just mentioned. That pushes the real cost closer to 10 million. 10 million US dollars. That's blood transfusions, antibiotics, surgery, long hospital stays. Women hide pregnancies, of course, for many reasons: good, bad, complicated. They try to abort quietly, then get complications. They hide those too, and only show up when the pain is unbearable and the blood loss is no longer deniable. Not because they love danger, because arrest is part of that treatment plan. Take the real case of Nonotile Lolo, a 26-year-old nurse from Lawayo. She helped a 16-year-old in an abortion emergency. She didn't get a medal, she got charged. Now, ask yourself a very honest question. After that headline, tell me, who's walking into a hospital early with an abortion complication? Exactly. Let's be very clear. Zimbabwe already pays for abortion. It just pays for it late, loudly, dangerously, expensively after someone nearly dies. Because right now the system isn't stopping abortion. It's just deciding who bleeds long enough to deserve help and how much the state overpays for that privilege. So what do you think?